Orthodontic health is more than just a perfect smile. It is a key part of the overall well-being. From breathing and sleep to confidence and self-image, the alignment of our teeth and jaws affects far more than we realize today. We explore the hidden impact of the orthodontics care and how modern dentistry is transforming both health and confidence. To talk more about that, let's welcome our dear guest, Dr. Fawaz Almutairi. He's a consultant, cornofacial orthodontist, member of the Royal College of the Surgeons in the Andabra, and also the Carifocal Ormond Street Hospital of the Children at the London in UK. So hello and good morning, Doctor.
Good morning, Kuwait. Good morning to you and good morning to your dear viewers. Thank you for having me in today.
You are most welcome. So today we're going to talk about the orthodontics. Some people actually delaying having or visiting dentist after the problem appears in their teeth. So let's talk about how it's really important to have the early detection of that.
Actually, the main reason for patients delaying their treatment is that they don't realize the negative impact of teeth being malaligned or misaligned on their health. And there is always also the factor of the cost and also time commitment.
Yes.
It leads to patients delaying their treatment and having negative impacts in the future.
Okay, so it's like early detection, like at very early ages, let's say.
We always advise early detection and early consultation starting from the age of 7 years old or between 7 and 9 years old.
Yeah.
Because early detection means always either intercepting issues early, treating them early, or making them at least easier to treat in the future.
Okay, so doctor, how does the position of our teeth-free jaw affect, let's say, overall health, not only our smile?
Of course, this is a very important question because when people think about braces treatment or orthodontic treatment, they always think about the aesthetics of it. However, it's beyond that. The position of the teeth affects many aspects of the patient's health, starting with the oral health. Malaligned teeth, misaligned teeth introduce areas which are very hard to clean, and that in some occasions or most of the time lead
Yes.
to issues with the gums, lead to health issues with the gums.
Mm-hmm.
Also, if patients have malaligned teeth, issues with the jaw, issues with the bite,
Yes.
then they don't function properly. Like they have issues with the speech, they have issues with mastication, and also they have issues with digestion.
So it's actually caused too many problems. Even let's say the misalignment of the teeth can cause some headache and sleep problems, and also, as I mentioned, digestive problem. So that's true.
It is a multifactorial issue, and yes, as you mentioned, that's part of it, because when someone has, let's say, or put it in simple terms,
Mm-hmm.
a malaligned occlusion that puts lots of stress on the masticatory muscles or the muscles that are around the jaws that
Yeah.
we use for mastication, which might lead to issues with the joint,
Yeah.
with the jaw joint, and also lead to stress in the muscles and in some occasions headaches.
And headaches as well. So when should parents actually, let's say, start caring about their children's jaw and bite and teeth?
The guidelines always advise to see a children dentist or an orthodontist between the age of 7 and 9. The importance of that age is when the child starts to change from baby teeth to adult teeth.
Yes.
And it's an important period because we don't only treat issues, but we also monitor development of the teeth, eruption of the teeth, and also growth issues.
Okay.
So if we detect problems early, it's very beneficial in either intercepting them, treating them, or even introduce some solutions to make them easy to treat in the future.
Okay, so doctor, you mentioned about how it's really important to start our early detection. So what are the risks actually of people actually delaying visiting the orthodontic?
People would always say, let's do it later, let's wait. And I would say the first issue, as we mentioned previously, is that issues would become much harder to treat in the future.
Okay.
In other occasions, we lose very important periods of life, of the life of the child, where if we don't interfere at that specific time, then the treatment cannot be applied at later times, especially in treatments that we have to introduce growth modifications, encouraging jaws to grow. In other occasions, some children might have jaw issues that can affect, for example, breathing, and that affects also the quality of sleep. So the first issue, things might become much harder in the future to treat, or they might cause an increase in the cost of the treatment, or even resort to other treatments like surgical interventions. So it would be always advised to detect issues early and try to solve them as early as possible.
Yeah, it's very shocking actually, doctor, how everything is related. You said that really affect their breathing and then the quality of their sleep, and also of course can affect their educational in the future. And then nevertheless, their smiles, as you mentioned, how they bite, their eating habits. So as you mentioned, doctor, it's very important to start the early detection. So what are the health differences actually between the normal, the traditional braces, and also the clear aligner, let's say?
Both are considered options for the treatment, and we basically choose them depending on the suitability of the appliance and also patient choice,
yes,
and sometimes cost consideration. However, the main 2 points I would like to talk about, the first one is the ability to keep a very good oral hygiene, good oral health, good gum health, and good teeth health. So if we compare the train track braces, as we call them, or the metal braces, with clear aligners or clear braces,
yes,
then if the brace is fixed to the teeth, it becomes harder to clean, and if there is no compliance with proper hygiene regime, then that might introduce issues. Compared to the clear aligners, where we can remove them, clean the teeth easily, use the dental brush, use the floss without any interference, then that would really help with improving the oral health throughout the treatment.
yes.
However, in both options, we need compliance. The other part is metal braces being rough in some areas that might cause some rubbing against the lips, the cheeks, and it might introduce some nauseance. However, in clear aligners, it's much better in that issue.
In that issue. So are aligners really, let's say, effective and work in the, let's say, complex cases, or only for the cosmetic, let's say, trends?
What we've been saying in the past, that metal braces would be suitable or would be the best to treat severe cases, more complex cases, compared to clear aligners, which were introduced to use with mild and moderate cases. However, now with the new technologies and the advancements that we see over the years, clear aligners became a more efficient way to treat more cases. So we can confidently say, yes, clear aligners can now treat more cases. However, it all goes back to proper assessment and the choice of the treating clinician.
Yes. So, doctor, some people actually, they have really a beautiful teeth since they are born until, let's say, age 30 or 40, and then they start to having misalignments with their teeth. So let's talk about this case.
Teeth change with time because children grow and adults' body change over time.
Yes.
So you would expect some changes. In addition to the changes that goes on with the tissues around the teeth.
Okay.
One of the most common things we see with people is crowding of the teeth or overlapping of the teeth, especially in the front area or the teeth in the front. What we advise in that case, if patients notice that this overlapping is increasing with time, that would be a reason for treatment.
So it should be it's treatable, actually, or curable, let's say, even if it's like 50 or 40 years old?
Yes, well, age is used to be one of the myths that people would believe, saying braces treatment is only for children, and that's not true. Braces treatment can be done for anyone, at any age, given that there are no health considerations that would prevent us from doing the treatment. Now, adults can do the treatment easily, having the options of, let's say, clear aligners that would be easy to use with their professional and their social situations, lingual braces that are put on the inside of the teeth, inside surface of the teeth, the inner surface of the teeth, and these advancements allowed adults to discreetly, let's say, have the treatment without affecting their professional status or their social status. So it is easy.
It is easy. So, doctor, there is a picture shown on the screen there. We'd like from you to explain for us some of the cases that are shown there.
Well, these are the situations that we treat for. So if we see the open bite, that's the vertical overlap. The crowding is what we just mentioned, the overlapping of the teeth, having shortage of space, the excessive spacing. Cross bite means teeth biting on the other side where they should bite, whether it's in the back teeth or the front teeth. Deep bite, that's also the vertical overlap. And then in the bottom we can see jaw issues, whether it's shortage of space, class 2, what we call class 2, which is a small mandible or a small lower jaw, and then a bigger lower jaw. These are the main issues, but we have a wide array of issues.
Like wider than those, let's say, common
These
cases.
are the main common cases,
the main common cases, actually. So do you see emotional changes in your patients as when they actually, when they smile beautifully after your treatment, doctor?
This is one of the most interesting parts of our job. Patients go through a huge emotional transformation after they take their braces off. You can see it in their eyes. You can see it in their smile. They have an increased self-confidence, increased self-esteem, and it's not uncommon to see patients being more outgoing, more confident, and not even afraid to take new opportunities, let's say. And it's actually one of the most rewarding aspects of our jobs to see that transformation with our patients.
Wow, that's a great actually feelings. You feel proud actually after you finish from all the beautiful smiles actually, and also fixing all the problems and cases, doctor. So of course gonna be really let's say impact the self-confidence and the well-being, the mental well-being as well. Are there any link between orthodontic issues and the speech and breathing problems, doctor?
Yes, there is actually a link, because when we don't have teeth that are in the correct position, then that introduces issues with the speech, like lisps, not being able to pronounce specific sounds or letters. And in regard to introducing the treatment to improve that after placing the teeth in the correct position. And the other issue was, sorry? The other part was, so speech and
let's say the breathing as well, doctor.
And the breathing, of course. So when we see children or adults with small jaw, the small jaw is in a retruded position, and that puts the tongue into a narrower position, leading to narrow airway, which might introduce, in some cases, issues with the sleep, or what we call sleep apnea, so shortness of breath while sleeping. Orthodontic treatment is being introduced to solve that issue in regard to the children by encouraging the lower jaw to grow forward, increasing the airway to solve that part. And in adults, sometimes we resort to either devices to help with the sleep apnea issue, or in some severe cases, lower jaw surgery to pull the jaw forward and increase the airway in the back.
Okay, that's really amazing, doctor. So some people, they want, let's say, quick fix. What are the dangers of going, actually rushing to the dentist and saying, I want really, like within 2 months, I want my teeth fixed?
Well, actually, modern orthodontists really suffer with that part because of the introduction of some commercial marketing products that would promise correction of the severe issues within a very short period of time, automated treatments without any supervision of the doctors. So patients start to demand that treatment is being finished in a shorter time. I always tell patients orthodontic treatment is like training your muscles. If you go to the gym, if you go slow, you gain strength. If you go fast, you gain injury, let's say.
Yes.
So doing the treatment fast would increase the risks related to the treatment, like root resorption. Root resorption means the shortening of the root of the tooth, leading to issues with the stability of the tooth. And also, when we treat the teeth and move them, we want to ensure a very stable position.
Yes.
And that stable position would ensure long-term stability, which means when we take the brace off, with the retainers, the teeth would become stable for a long time. If we rush treatment, we don't allow for the teeth to normalize in the new position, and then we have issues with long-term stability, or what we call relapse, teeth trying to go back to their original position because we pushed them really hard in a very short time.
So patient is the key. Don't rush treatment, dear viewers.
Course.
So Dr. it was really available information actually you gave us about the orthodontic and the craniofacial as well. Thank you for being here in Good Morning Kuwait.
Thank you for having me in. Thank you.
Big thanks and appreciation to our dear guest, Dr. Fawaz Almutairi. He's a consultant craniofacial orthodontist, a member of the Royal College of the Surgeons in Edinburgh, and also the craniofacial fellow of Great Ormond Street Hospital of Children in London, UK. That was all we have for our first guest interview, so don't go away, dear viewer. Let's have the sanitary break and then we'll move on.